It lasts only a few minutes. Your hand suddenly feels numb and clumsy, and you can't quite grip your coffee cup. Or a word comes out of your mouth slurred and strange, and your spouse gives you an odd look. Or the room tilts and spins for no reason, and then, just as quickly as it came, it passes. You feel fine again. So you tell yourself it was nothing. You were tired. You stood up too fast. You move on with your day. And that, right there, may be the most dangerous decision of your entire life. Because what you just experienced was very likely not nothing. It may have been your body sounding its final alarm. A warning, sometimes a full day before a major, devastating stroke, handing you the one chance you'll ever get to prevent it. And most people, tragically, miss it completely. Today I'm going to make absolutely sure you are not one of those people. I'm going to show you the warning signs that can appear in the hours and days before a stroke. The mini-stroke that almost everyone ignores. The symptoms most seniors brush off as just getting old. And I'm going to give you the simple test that can tell in seconds whether someone is having a stroke right now. Most importantly, I'm going to tell you the one mistake that turns a survivable warning into a permanent tragedy. Waiting to see if it passes. Stay with me through the whole video because this is not information to half know. This is the kind of knowing that saves a life. Maybe yours, maybe your spouse's, maybe a stranger's at the next table. My name is Dr. Paul Brenner, and in over 30 years of practice, the strokes that haunt me most are not the ones we couldn't treat. They're the ones where the warning was there, and it was missed. Let's make sure that never happens to you. Before we begin, please subscribe, because this is genuinely life-saving information, and your sharing it could be the reason someone you love survives. Let's begin. First, let me explain what a stroke actually is, because understanding it is what makes the warning signs make sense, and what makes the urgency real. Your brain is an incredibly hungry organ. It demands a constant, rich supply of oxygen-carrying blood every second of every day. A stroke is what happens when that blood supply to part of the brain is suddenly cut off. There are two main ways this happens. The most common, by far, is an ischemic stroke. A blood clot blocks an artery feeding the brain, and the brain tissue downstream begins to starve. The second is a hemorrhagic stroke. A blood vessel in the brain bursts and bleeds. Either way, the result is the same, and it is brutal. Brain cells begin to die. And here's the phrase I need you to burn into your memory, because it explains everything about why speed matters so much. In the world of stroke care, we say, time is brain. During a stroke, your brain loses an estimated nearly 2 million brain cells every single minute that goes by untreated. Every minute. So the difference between calling for help immediately and waiting to see can be the difference between walking out of the hospital a week later and never speaking, walking, or living independently again. Hold on to that. Time is brain, because it's the reason the warning signs we're about to cover are so precious. So let's talk about those warnings, the signals your body may send in the hours and even the day before a major stroke strikes. And the single most important one, the one I need you to understand above all others, is the mini-stroke. The medical name is a transient ischemic attack, or TIA. Here's what it is. A clot temporarily blocks blood flow to part of the brain, causing real stroke symptoms. But then the clot breaks up or moves on its own. Blood flow is restored and the symptoms vanish, usually within a few minutes to an hour. The person feels completely normal again. And that is exactly what makes it so deadly. Because it feels like a false alarm, like nothing happened, so people don't call for help. But listen to me very carefully. A TIA is not a false alarm. It is a warning shot. It is your body telling you, in the clearest language it has, that the machinery for a major stroke is in place and ready to fire. The statistics are sobering. A significant portion of people who have a TIA go on to have a full-blown stroke. And many of those strokes come within the next 48 hours, sometimes within hours. So that brief episode that passed is not a reason to relax. It is a screaming, time-limited opportunity to act and prevent the catastrophe. If you take only one thing from this video, let it be this. A symptom that comes and goes is still an emergency. Now let me show you exactly what those symptoms look like, because they're often quieter and stranger than people expect. The classic warning signs, whether they last minutes as a TIA or come on and stay, tend to be sudden. That's the key word, sudden. The first is sudden numbness or weakness, especially on one side of the body. One arm that goes heavy or won't lift. One side of the face that feels strange. A leg that suddenly drags. One-sidedness is a major clue, because each side of your brain controls the opposite side of your body. The second is sudden trouble speaking, words that slur, or the frightening experience of knowing exactly what you want to say but being unable to find the words, or not understanding what someone is saying to you. The third is sudden vision trouble, blurred or double vision, or a strange sensation like a dark curtain coming down over one eye. The fourth is sudden dizziness, a loss of balance or coordination, a sense of the world spinning or of suddenly being unable to walk straight. And this one is so often blamed on age or an inner ear problem and dismissed. And the fifth is a sudden, severe headache unlike any you've had before. What people describe as the worst headache of my life, coming out of nowhere, which can be a sign of bleeding in the brain. There's one more I especially want the women watching to hear, because strokes in women can show up in subtler ways. A sudden, overwhelming fatigue, confusion, or just a powerful sense that something is profoundly wrong. Any of these, especially coming on suddenly, is a red flag, and if several come together, it is an absolute emergency. But how do you tell, in the moment, in those frightening few seconds, whether what you're seeing is really a stroke? For that, there's a simple test that I want every single person watching to memorize, because you might use it on a loved one someday with the clock ticking. Let me give you that test now, and please, learn it by heart. The word is fast. F-A-S-T. F is for face. Ask the person to smile and look closely. Does one side of their face droop? Does the smile look uneven? A is for arms. Ask them to raise both arms straight out in front of them and hold. Does one arm drift downward, or can they not lift it at all? S is for speech. Ask them to repeat a simple sentence. Is their speech slurred, strange, or jumbled? And T is for time. If you see any one of those signs, it is time to call emergency services immediately. Note the time you first saw the symptoms and make the call. Now, doctors have recently expanded this to an even better acronym, BE FAST, adding two earlier signs, B for balance, a sudden loss of balance or coordination, and E for eyes, sudden vision trouble. Balance, eyes, face, arms, speech, time. Be fast. If you remember nothing else from today, remember that word, because it is the difference between recognizing a stroke and standing there confused while precious minutes and millions of brain cells slip away. Let me pause here for just a moment, because I want to hear from you, and your answer matters. In the comments below, tell me honestly, have you or someone you love ever had one of these sudden moments? A hand going numb, word slurring, a spell of dizziness or strange vision that lasted a little while and then passed and you brushed it off? Just type yes if that's happened. I ask because if it has, this next part is the most important thing I'll tell you today. And if this video is opening your eyes, please tap the like button. It takes 1 second and it helps YouTube put this in front of more people who need to see it before it's too late. Thank you. Now here is the mistake that costs people everything. The deadliest mistake, and I have seen it break families, is waiting. Let me lie down and see if it passes. I don't want to make a fuss. I'll call the doctor in the morning. I feel fine now, so it must have been nothing. Every one of those thoughts is completely understandable, and every one of them can be catastrophic. Here is why. For the most common kind of stroke, the clot type, there are powerful treatments, clot-dissolving medications, and procedures to physically remove the clot that can dramatically reduce the damage or even reverse it. But these treatments only work within a narrow window of time, often just a few hours from when symptoms begin. Miss that window, and the chance is gone, and the damage becomes permanent. This is why waiting to see is so devastating. You are spending the one currency you cannot get back, time. And I need to address the TIA again, because this is where people go most wrong. If the symptoms pass and the person feels fine, the temptation to not call is enormous. Resist it with everything you have. Call emergency services anyway. Because that resolved TIA means a stroke may be hours away, and getting to the hospital now, while you feel fine, is exactly how doctors find the cause and stop the big one from ever happening. Feeling fine again is not the all clear. It is the warning. Now let me give you the rules for what to actually do, because there are a couple of things people get dangerously wrong. If you suspect a stroke in yourself or anyone else, here's exactly what to do. First, call emergency services, your local emergency number, immediately. Do not call your doctor's office and wait for a call back. Do not wait for a family member to come over. Call for an ambulance. Why an ambulance and not driving yourself? 2 reasons. The paramedics can begin assessing and treating on the way, and just as importantly, they know which hospitals are equipped as stroke centers and will take you to the right one, fast. Second, look at the clock and note the exact time the symptoms started. This single piece of information is critical because it determines which treatments the doctors can safely use. If the person woke up with symptoms, note when they were last seen normal. Third, and please pay close attention to this one, because it's the opposite of what many of you have heard for heart attacks. Do not give aspirin for a suspected stroke. For a heart attack, aspirin can help, but a stroke might be the bleeding kind, and aspirin thins the blood, which could make a brain bleed catastrophically worse. So no aspirin, no food, no drink, just call for help and keep the person calm, safe, and still until it arrives. Those rules are simple, but in a real emergency, simple and known is exactly what saves lives. Now, I don't want to leave you only with how to react. I want to help you prevent ever needing to. Because the truth is, the large majority of strokes are preventable, and they share a handful of risk factors you have real power over. The number one risk factor for stroke, by far, is high blood pressure. That silent pressure quietly damaging and weakening your arteries until one gives way or a clot forms. Keeping your blood pressure controlled is the single most powerful thing you can do to prevent a stroke, which is exactly why we talk about it so much on this channel. The second is an irregular heart rhythm called atrial fibrillation, or AFib. When the heart quivers instead of beating cleanly, blood can pool and form clots that travel to the brain. A fib is common, often silent, and hugely important to detect and treat, because the right treatment slashes stroke risk. So if your heartbeat ever feels fluttering, racing, or irregular, get it checked. Beyond those two, the familiar list. Keep your blood sugar and cholesterol in check. Do not smoke. Smoking dramatically raises stroke risk. Stay physically active, and eat in a way that protects your blood vessels. Control those, and you tilt the odds powerfully in your favor. Prevention isn't glamorous, but it is how the smartest people never have to use the fast test on themselves at all. Let me bring this together into the simple plan I'd hand you on an index card. 1. Memorize, be fast. Balance, eyes, face, arms, speech, time. 2. Understand that any of these signs that comes on suddenly is an emergency, and that a mini stroke that passes is a warning, not an all clear. 3. If you see the signs, call emergency services immediately. Note the time symptoms began, do not drive yourself, and do not give aspirin. 4. Never, ever wait to see if it passes. Time is brain. And 5. Prevent it by controlling your blood pressure above all, treating AFib, and managing your sugar, cholesterol, and weight. Print it, put it on your fridge, and tell your family. That index card is one of the most valuable things in your home. Let me tell you about a patient. I'll call him Arthur, 72, a stubborn, proud man, and his stubbornness very nearly cost him everything. One afternoon, for about 10 minutes, the right side of Arthur's face drooped and his speech came out slurred. Then it cleared completely and he felt perfectly normal. "See," he told his wife, Joan, "I'm fine. It was nothing. I'm not going to any hospital over nothing." But Joan had watched a video much like this one. She knew that fine again was not the all clear. It was the warning. And she did the bravest, most loving thing she could have done. She ignored his protests and called for an ambulance anyway. At the hospital, they confirmed it had been a TIA, a warning stroke. They found a dangerously narrowed artery in his neck and an irregular heart rhythm he never knew he had. They treated the artery, started him on the right medication for his heart, and got his blood pressure under control. The major stroke that was, by every measure, bearing down on him within days, never came. Arthur is still here, still stubborn, still golfing, still telling that story, and he tells it now to talk other men out of the very mistake he almost made. Joan's refusal to wait and see gave him the rest of his life. That is the power of what you've learned today. So here's what I want you to do right now, before you click away, and just pick one thing. Maybe it's saying the word "be fast" out loud a few times until it sticks. Maybe it's telling your spouse or a friend. Today, if you ever see my face droop or hear me slur, call an ambulance even if I tell you I'm fine. Maybe it's finally making the appointment to get that blood pressure or that fluttering heartbeat checked. Just one step. Start there. Because when it comes to stroke, knowledge isn't just power. It is quite literally time. And time is brain. And brain is your whole life. If this video could help even one person act in time, then please give it a like and share it with everyone you love. Your parents, your spouse, your friends. Because the person who needs to recognize a stroke is almost never the one having it. It's the person standing next to them. Your share could be the reason someone makes the call. And if you're not yet subscribed, please join us, because every week I bring you honest, clear, doctor-explained guidance to help you and your family stay safe, strong, and independent. And one final, vital reminder. Everything I've shared today is general education, not personal medical advice. But this part is not a suggestion. It is a rule that saves lives. If you ever see the signs of a stroke, whether they last or whether they pass, call emergency services immediately. Do not wait, do not drive yourself, and do not take aspirin for a suspected stroke. When it comes to your brain, there is no such thing as overreacting. Take care of yourself, take care of the people you love, and remember, when in doubt, make the call.